Hi guys, my name is Job. I'm one of the medical SHOs working on Richmond AMU at the moment. I work as a junior clinical fellow, and in this presentation I want to explain you a few things about how we work as a team of doctors on Richmond ward. And specifically I want to talk about the different shifts there are and the different roles there are for both the F1s, SHOs and registrars while working on the ward. So I'm not going to talk a lot about the take team and night team because these have been explained in an earlier presentation, but I want to talk about the other shifts that we have on Richmond ward. So the first shift I quickly want to talk about is the post-nights team. This is a team that consists of one SHO and one F1. This shift, you usually have it either 2 days in a row, Monday to Tuesday, or 3 days in a row, Wednesday to Friday. Depends on whether you're an F1 or an SHO. And the shift starts at 8 a.m. in the morning. You will join the overnight take team, and the on-call consultant who's been on call that night and will be on call that day as well will join you to do a board round together with the overnight take team. And the shift ends at 6 p.m. So I quickly want to say that for this shift, it's very important that you are there at 8 a.m. with a computer ready to start, because between 8 a.m. and 10 a.m. you will do a ward round and see all the patients that have been admitted or clerked overnight. So it's quite important that this ward round goes quite fluent, so you have plenty of time in the afternoon to finish all your jobs. So be sure you're on time and start at 8 a.m. So after you finish your ward round at roughly 10 or 11 a.m., you then have time to work on the jobs for the patients that have been admitted overnight to the unit. And at 3 p.m. or sometimes at 2 p.m., you catch up with your consultant and you explain what jobs you've done and what needs to be done later in the afternoon. And you will contribute to the 3 p.m. board round if your consultant requests that, to update the nursing team who's going home and who needs to go where. So besides the post-nights team, there's also the post-take team. So this is usually the same team that's been on take the day before. So for example, on Monday you do take, and then you clerk a lot of patients, and then on Tuesday you again go to the ward. You start at 8:30 in the morning, and you'll be post-take. So you will know the patients already because these are the patients you've clerked the day before. And this shift starts at 8:30 with a morning board round for a handover, and you will see all the patients from the day before together with the consultant. You do a ward round, and then you do all the jobs for the patients. This shift usually ends at 5, but sometimes it can include ward cover roles until 9:30 p.m. And in the weekend, you will help the take, which can get quite busy during the weekend, from 5 to 9:30 p.m. onwards. This shift is always run by the consultant who was on call and also the registrar who was on call. Usually the consultant and the registrar, they attend the 11 a.m. triage meeting. For the SHOs and the F1s, they can just continue with doing all the jobs. And again, there will be the 3 p.m. board round, which you can contribute to. Then we have AMC and AAA. I think it's been earlier explained already where this is, AMC and AAA, and what kind of how this works, this clinic and this ambulatory assessment area. So if you are an SHO, so this shift is not for F1. So if you are an SHO, you can have this shift. So there's 2 SHOs that work during the week in AMC, AAA. There is the AMC SHO and there is the AAA booster SHO. So both of them start at 8:30 in the morning, and you start your day by going through the clinic list. So one of the nurses will print a list, and then together with the registrar, who's on AMC as well, you divide which patients you'll see, either the telephones or the face-to-face patients, and you decide what investigations need to be done. For example, you decide if bloods need to be taken, and you can organize your clinic. The clinic will start at 9, and it usually runs until 12:30. Once you finish your clinic and you've had your break, you then join the on-call team and help clerking in AAA. So for the AMC SHO, this shift finishes at 5 p.m. And for the AAA booster SHO, which is always a long day shift, the shift will end at 9:30 p.m. Then we have virtual clinic. So virtual clinic is basically a clinic that's run by a registrar and a consultant together. It's a virtual clinic, so it's done via telephone and with a computer. And this was discussed in a separate session, but the clinic runs between 9 a.m. in the morning and 1 p.m. And you will see the registrar sitting in the doctor's office on the first floor in the Richmond Annex doing this clinic. Then we have the AAA booster registrar. So these are specialty registrars who do their standard role between 8:30 and 5 p.m. And then they are expected to be at 5 in AAA. They help clerking because it's always very busy on take during that time. And they will take over the on-call bleep so that the registrar who's on call can prepare the handover, can print the list, and can add a few things if needed. And then you also take over the GP referral bleep from 5. It usually doesn't get bleeped after 5, but it's important you take over both those bleeps so the on-call team can have time to finish all their jobs in time. And this shift will then end after handover at 9:30 p.m. Then we have the twilight shift. This is also an SHO only shift. It's basically a clerking shift in the afternoon where the take picks up. You start at 2 p.m., you work until 10 p.m., and you're just clerking with the on-call team. So you'll sit in AAA, find a computer there, and just clerk. Then we have this standard shift. You'll find quite a lot of these in your rota. So standard shifts are normal shifts, 8:30 to 5. These are also the shifts you can request annual leave for because there's usually quite a lot of people on standard. And you look after the patients who are on standard in Richmond ward. So a patient becomes standard when he's been for 2 days in AMU. And you see these patients with the physician of the week. So you have the same consultant the whole week. And then together you will see the patients. So it depends on time of the year, but usually there are not that many standard patients on the ward. So it's quite likely that if there's many standard doctors, you will be divided amongst other teams and asked to help them if they are very busy. For example, if the post-night team have a lot of patients from overnight, you will be expected to help them to make sure that all the jobs are done. So it's very important we all work as a team, even though there's different shift roles. It's important to help each other and to make sure that, because the unit only works well if everyone helps each other so that the patients get their jobs done in time. So out of hours, we have ward cover roles. So these roles start from 5 p.m. onwards. And you will use an electronic jobs list, which has been generated by doctors from all the internal medicine wards across the hospital. And there are allocated areas. So, for example, there will be F1 and SHO covering Lanesborough, St. James, and AMU. But there will also be float roles. So you are basically expected to work as a team together, again, like I explained before, and share the workload where possible. There's designated bleeps for these roles. So there's a St. James SHO bleep and Lanesborough SHO bleep, and there's also an award cover F1 bleep. And if you're on ward cover overnight, you are expected to help the take. Sometimes ward cover roles can be can be not that busy, so then it's good to help the take team overnight. And the Lanesborough SHO is expected to clerk overnight specialty patients for hematology, oncology, and CIU. Usually these are sometimes like 1 or 2 patients a night, so it doesn't happen that often. Then we have the crash bleeps. So like I explained before, the ward cover roles, they have their designated bleeps, and these are crash bleeps. So if there is an out of hours cardiac arrest in, for example, Lanesborough wing or St. James wing, that SHO is expected to go there. So that means that it is very important that these bleeps are being carried always by any doctor, because what can happen sometimes if you arrive in the morning and it's not clear which doctor is going to do ward cover from 5 p.m. onwards, for example, because they're not on site. You can leave your bleep in the hospital, but it's important you leave your bleep with someone. So either give it to the AAA booster SHO, give it to the MC SHO, so that if something happens during the day, if there is a crash call during the day, that someone can attend. So this is very important. Do not leave the bleeps just somewhere. give them to a doctor, and then make sure you communicate with the doctor who is expected to carry the bleep from 5, where they can find the bleep that day. So this was a short description on the shift roles and shift times. Now I quickly want to talk about hospital at night as well. So hospital at night is the basically the team that works overnight, and they work with the electronic jobs list I talked about earlier. So hospital at night is a team to cover the wards. So St. James, SHO, AMU, Lanesborough, and there's also 2 senior nurse practitioners who help you with jobs, with cannulas, with all kinds of things. They are amazing. They know everything. They know the whole hospital. They carry crash bleeps as well. So it is very important you work together with them because they are just amazing. You will find your jobs list on EPR. I'll explain that later. And your shift starts at 9, and you will get a verbal handover. So anything critical on the jobs list or anything else that's not on the jobs list, you'll receive by a good verbal handover at 9 p.m. In the seminar room in Richmond Ward. So if you want to put something on hospital at night, it's very important because sometimes the list can be quite chunky. It's quite important that you need to realize, does this need to be done out of hours? So for example, checking bloods overnight, is it really necessary? And if you're not sure, just discuss with your registrar, with your SHO, with your consultant, whether you feel that this requires either review of the weekend or review over the night. And also think about who's best suited to take on this task. So if it's just chasing U&Es, for example, which have been sent late to the lab, don't ask the registrar or SHO to chase this. You can just ask the F1 who's doing work cover to follow up these bloods. So if you are yourself late and you want to add something to the list past 5, you can, but you also need to call the on-call work cover team, because basically if you start your work cover shift, you will open the jobs list at 5. Usually you print it off and then you start working from there. So anything you want to add after 5, you will need to verbally hand over to them. So I'll now show you how to open the electronic jobs list and how to add something for a hospital night review. So if you log into EPR, everyone will have EPR login. You will open the patient you want to add something to the hospital night list. So on the left top of the screen, you can see here's your test patient. This is the patient menu, which will open for anyone you open on EPR, any patient. And then you click on hospital at night actions. You'll find this. So you'll see the completed and outstanding actions for this patient. As you can see, there's currently no actions for this patient. Then on the right bottom corner, you can click Add Action. That will open this screen. So basically here, under Grade ID, you can select who needs to chase up this job. So either F1, SHO, or registrar. You select the EWS score for this patient, and you request the appropriate time and date. Then here under diagnosis, you quickly write down what's their current diagnosis, what they're being treated for. And then below here under action required, you can document like, please chase bloods, please, anything basically you feel that needs handing over, just document that there under action required. Once you finish your action, in the bottom right corner, you can click Save, and then it's added to the hospital night list. So if you're work cover yourself and you want to review the complete list for your specific area, so for example, for St. James Wing, what you do is you open a patient, but then instead of going to the patient menu, you click on the left side to hospital at night. So you will leave that patient then, and then you can open the list. So if you're an SHO, you click your grade, senior house officer, then you click on hospital at night team, which area, so in this case, St. James, for example, and then you will see the complete list. So it's important that these are all the jobs that are on the list. So it will be jobs between 5 and 9, but sometimes also jobs for overnight. So just quickly see what jobs you'll need to do if you're on the work cover role between 5 and 9, or if you're on the night work cover role. And if you finish your job, it's very important to complete it. If you haven't finished your job, you can review it and you can add a new action, for example, Or so if you need to take an early morning ABG, but you couldn't manage, it was very, very busy, you can review it and then document. I've added it on for the next day because it was too busy. If you finish something, you can complete it and then quickly document. So if the jobs, for example, take early morning ABG, then you document ABG taken, please see iClip for results, and then complete the action. So if you come a day after, that the list looks tidy and is clear from all jobs that have actually been done. So this is something you should not forget. All right, so this is it. This was my quick talk on shift descriptions, shift times, different roles on Richmond AMU, and how Hospital at Night works. Thank you very much.